Snow days are the best days. Oh. Alright, ladies and gents, let's talk about muscles of the thigh and upper leg. We're also going to talk about in this video, and its second video, we're going to finish up with the last bit of muscles. So this is your last set that you're going to get from me in terms of muscles of the human body that you guys are going to know. So I'm going to move through these kind of fast. At this point, you guys should have it down and what you should be looking for, origin, insertion, and action for each of these muscles in the leg. We'll see most of these muscles on the cat. There are a couple that we probably won't be able to see just because of the size and location on the cat. But again, these are all the muscles you're going to need to know for your human practical. Okay. All right, so let's start talking about muscles of the leg. What we have here is the sartorius. So the sartorius is this really long muscle right here. So if you look down this way, it goes all the way up from the top of your leg all the way down to the knee. So it starts actually on your pelvic bone. With the sartorius, it's the longest muscle in the body. It goes across the entire front of your leg. Its origin, anterior superior spine of the ilium. So it's going to start up here in the pelvis at one of those spines. It's going to insert on the medial surface of the tibia, near the tibial tuberosity. So not directly on it, but right above it. So when you guys are describing origin, anterior superior spine of the ilium, that's what you need to write. An insertion, medial surface of tibia is fine. You can say near tibial tuberosity. That's also acceptable. So near tibial tuberosity, not tibial tuberosity. And that's what you can describe it. Its action, it deals with flexion of the knee and lateral rotation of the hip. So the sartorius, it doesn't do a whole lot of, it's not a super powerful muscle, but it does aid quite a bit in flexion at the knee. And then it does assist with lateral rotation of the hip more so than flexion. But both of those are actions. Next one, tensor fascia lata. So its name implies exactly what it does. Its main job is to tense fascia. Okay, so it actually pulls on a tendon and allows your muscle to tighten and pull that so that you can use that to help with flexion and movement in the leg. So it's a muscle that's on the side, right here. It's going to actually start on the iliac crest up here. All right, so iliac crest and surface of the ilium between the anterior iliac spines. So what that means is that it's going to start up here. So you got your anterior superior and then your anterior posterior iliac spine, or inferior iliac spine. So it's going to start between those and it's going to insert into this iliotibial tract. So iliotibial tract, this is actually just connective tissue. It's a big aponeurosis. You guys will actually see under a cat. We'll actually puncture it to get to some of the other stuff below it. But you can also call it your ITB or your IT band. I'm sure some of you have heard of that before. All of those are words and abbreviations that describe this part. So if you write ITB or IT band instead of iliotibial tract on your test, I'll accept it. So actions, it does a lot of different things, but its name implies exactly what it does. It tenses the fascia lata. All right, so it tenses this fascia, and lata is lateral, so this lateral fascia. So it pulls on this stuff right here. The tensor fascia lata, again, it's a small muscle. It helps support the knee. It provides a lot of stabilization. Its main job. The next muscles we're going to talk about are your gluteal muscles, so your butt muscles. Okay, this is your butt. This is what you all are sitting on as you watch this video. That's what I'm sitting on right now as I describe the parts of it. So for the gluteal muscles, there are actually not one, not two, but three that you guys will need to know in the human. And they are kind of layered on top of each other. So I'm going to talk about all three of them. If you look, their origin, insertion, and action, unlike the other muscles that we've been talking about that are in groups, like the tricep in the last video you guys watched, they all have different origins, insertions, and actions. Okay, so that's something that you have to keep in mind, that the gluteal muscles, they're not all the same. They're all different. But they're similar in what they do, and they deal with hip things. All right, so we're going to start with the gluteus medius. So as the name implies, it's the butt muscle in the middle. Okay, so it's in the middle butt muscle. And its origin, anterior iliac crest and lateral surface of the ilium. So it's going to begin up here on the inside of your ilium. All right, so in that indentation when you look at the pelvic bone. And it's going to insert on the greater trochanter of the femur. So it's going to insert right here on this outside part on the femur. Right, so it goes this way down. So I put all three here just to give you an idea. So the medius, one of the reasons why it's called the medius is actually sandwiched between the maximus and the minimus. Okay, so max, medium, minimum. So I remember max, med, min, and that it helps me remember the order. So the minimal is going to be the smallest one on the inside, medial is in the middle, and max is on the outside. So I start with the medius because this is the one that helps me orient myself when I'm describing the other two muscles. So I always try to find this one first. I'm not sure why. It helps me to remember that it's in the middle and that it goes to the greater trochanter, the femur. That's a very visible, easy spot to find when I'm trying to identify this muscle. So that's where I start. So gluteus medius, so in the middle. The next one we'll talk about is the gluteus maximus. All right, so gluteus maximus, this is the big one. All right, so this is the big muscle that you're all sitting on right now. With the gluteus maximus, it's a hip muscle. Again, it's going to abduction and medial rotation of the hip. So same action as our medius. All right, but its origin, iliac crest of the ilium, sacrum, and coccyx. So it's one of the few muscles that actually attaches the coccyx, and even then, it's very limited attachment on that part of the bone. So remember, that's a vestigial bone. We don't really use it very much anymore. So with that being said, so gluteus maximus is going to be in here, and it's going to insert on the IT band again, so that iliotibial tract and gluteal tuberosity of the femur. So again, gluteal tuberosity, so it's an indentation or a projection on the back. Intertrochanteric line, so back kind of over there on the femur. So think about it that way. So you can write IT band, that's fine for one of the insertions, and you can also say gluteal tuberosity. I'll accept that. And then again, it's abduction and medial rotation of the hip. All right, the last muscle is the medius, or gluteal minimus of the three. It's going to begin on the lateral surface of the ilium, so it actually is very deep. So this is the most deep of the muscles. All right, so it's going to be the furthest in. It's going to insert again on the greater trochanter of the femur. So it actually goes more to the anterior side of that as opposed to the gluteus medius. It's more of the superior side of that. So abduction and medial rotation of the hip. So all the actions are the same for your gluteal muscles. They all deal with moving of your hip, but they are kind of layered on top of each other. So minimus is the most deep, medius is in the center, and gluteus maximus kind of drapes over the top. So we'll look at all three of these in the cat. The next muscles, these are muscles that deal with extension and flexion at the knee. They are further down. They're large muscles, some of the larger muscles in the body. The first muscle, vastus lateralis. So vastus, they're just kind of large muscles. So that's how I remember it, vast being large. And lateralis, they're going to be on the lateral side. So you have a vastus lateralis. You also have another vastus muscle that we'll get to. All right, but vastus lateralis is going to be on the outside here. So on the lateral side. So start at the knee. It comes from there out to the lateral side. Origin, anterior and inferior greater trochanter of the femur and along the linea aspera. So remember that white line, that line that's going across the top of our fibula. That's what you're going to see. So we've got our vastus lateralis. It's going to go underneath this muscle up here, and it's going to continue down. It's going to insert on the tibial tuberosity by way of patellar ligaments. But these by-way muscles, yes, it's going to attach to a ligament that's going to go to that bone. But you guys can just write tibial tuberosity. So if you just want to write tibial tuberosity, that is fine with me. Okay, and then its action is going to actually be extension at the knee. So it's going to cause movement at the knee. All right, so in the last video, I talked about how when people describe their bicep muscle as being this flexion type muscle, all right, I hate that description, like I said. So in my opinion, when you're describing a bicep muscle, you need to indicate where it is. So the bicep, this is another one. Bicep means two. The sep means heads. So this is a muscle that has two heads. For the biceps femoris, we don't need to know both heads of this, but we're going to talk about how for this particular muscle, you guys are going to need to know, again, origin, insertion, and that each of these parts, you only need to know this one. So ischial tuberosity, linea aspera of the femur. So it's going to start up here on this butt part right here. Remember, ischial tuberosity is the bony part that you're sitting on. And it's going to insert on the head of the fibula. So it's going to go all the way down to the part of the fibula. So remember, fibula is on the lateral side. All right, this is a very large muscle with the biceps femoris. And you remember insertion, head of the fibula, and lateral condyle. So it's a pretty long muscle. It's going to go all the way down to the fibula. All right, and then part of it is going to stop at the tibia as well. So that's the other head of it. So it has two actions, flexion at knee and extension and lateral rotation of the hip. All right, so it's going to help extend your hip outward, and it's going to allow flexion at the knee. So when you pull up on it, it's going to pull on this part of the fibula and cause your knee to flex. So you can actually feel that if you feel the back of your knee. right? You can actually, and you flex it back and forth, you can actually feel that if you have your hand on the lateral side. This next muscle, semitendinosus. So semitendinosus means that it is a smaller muscle that's pulling on a tendon. It's going to begin in the same spot as your biceps femoris on the ischial tuberosity, so right there next to that, and it's going to go down to get to this tendon right here. This tendon, the semitendinosus tendon right here. Just remember posterior surface and medial condyle of tibia. You could say medial condyle of tibia, that is fine. Again, you got to tell me that it's on the tibia because we've learned that there are more than one condyle in the body. So it has two actions, flexion at the knee and extension and medial rotation at the hip. So a lot of these leg muscles have very similar actions. So if you can remember which ones have this one, that's one action that you're only going to need to do. This next muscle, gracilis. Okay, the gracilis begins on the inferior ramus of the pubis. So it's going to be, actually, it's a pretty superficial muscle. It's on the outside, and there's actually a nerve that runs down that muscle. So with this, it's going to insert medial surface of the tibia inferior to the medial condyle, so it actually goes below the condyle here on the tibia on the medial side. With the gracilis, so I have it labeled here. Again, it's going to pull down, it's going to go. It's one of the longer muscles in the body, and its main action is flexion at the knee and adduction and medial rotation at the hip. So it's a hip adductor, so that's bringing it back. It's adding to the body, adding to the midline. With the gracilis, I remember where it is just because of it's kind of that muscle if someone touches the inside of your thigh. I know this is a weird description, but this is how I remember it. It's that muscle that tingles, right? Because there's a nerve that goes right through there. So if someone grabs your thigh, right, it's that muscle and that nerve that you're actually feeling. So gracilis. Like another way I remember it, the gracilis is the thank you muscle. So thanks for touching my thigh. Again, not appropriate, but there you go. If that helps you remember it, I don't care. The next muscle, iliopsoas. This is actually a combination of two different muscles. So your iliacus and your psoas major. So the iliopsoas muscle, it's a large muscle. We've talked about parts of it. We've seen parts of it already. But the iliopsoas, it's going to begin on the medial surface of the ilium, anterior surfaces, and the transverse processes of T12 and the lumbar vertebrae. So it's a pretty hefty origin, and it has a pretty hefty insertion. So femur, distal to lesser trochanter, tendon fused to the psoas major, lesser trochanter in company with the iliacus. Okay, so that's a lot. Its main job, flexion of the hip and lumbar intervertebral joints. So it's actually pulling on your lumbar, so it's one of the reasons why you have that back support when you sit up, is that iliopsoas is going. So I talk about this muscle just because it's a very large one that takes up a large portion of what's going on here. Right, inside of your hip, inside of this area, but chances are I'm not going to ask you this one on the test. Okay, so I wouldn't spend a whole lot of time memorizing all of these parts for the origin insertion. I would say the action, though, is something that you should remember. Okay? So the name, identifying it, and knowing the action are the two things for that one. Pectineus. Okay, this is one muscle that is really short. It's a hip adductor, so again, it's going to pull the hip inward. It's going to begin on the superior ramus of the pubis, so it's going to start up here. Right, so top part of the ramus, right, it's going to go down to the inferior inferior to the lesser trochanter of the femur. So it's actually below this notch here. It's going to insert on that medial side of the femur. With this muscle, all right, so it's insertion there, its origin, those are things you know. Again, it's a hip adductor. So the pectineus is actually a pretty short muscle, but it's an important muscle to talk about. The reason why, if a lot of people who have leg pain, so if you've heard of sciatica, other leg issues, so like numbing as you get older, people experience this. It's because there is actually a nerve that goes right through there. So your pectineus, if it contracts, right, that nerve, so if this is the nerve going through the muscle, right, it's going to squeeze that, and that causes pain. So that's one reason why people have it. So stretching this muscle is an important one. All right, so I'm going to stop there for this video. There's going to be a second video that's going to continue going through the rest of the muscles, so you need to watch that. So that's our last video for what you guys need to know for the muscles. Okay, all right, so look forward to that one.